Hello. Today we're gonna learn the common mistakes and methods about CBT and what are the stress tolerating skill about the DBT. Just the introduction. We're gonna learn that. Okay. First, common mistake and methods about CBT. You will learn the truth behind the myth in this today. And you'll learn about the most common errors and how to avoid them. You can have great success in CBT if you bear this common mistakes and myths about CBT in your mind. Okay, common myths. Okay. First, CBT is a rigid, one-size-fits-all approach. One of the best things of CBT is that it is a flexible approach that can be applied to a number of conditions with many methods. While a person with depression will use one set of techniques, another set of techniques will be employed by a person with post-traumatic stress disorder. While the two individuals will use two different types of techniques, they will also use a few of the same methods to help restructure their cognition, such as journalizing. CBT is by no means linear or one size fits all. It is a highly customizable technique. So, therapists should be able to tailor their treatment plan to their specific needs whenever a person seeks a highly trained cognitive behavior therapist. A person can also customize his or her own plan when using this program, this lecture without the therapist's help. Number 2, CBT only focuses on replacing negativity with positive thinking. Okay? Cognitive behavior therapy focuses on more positive and less destructive cognitive rehabilitation. This is different from positive thinking drill. A person simply says something positive with the typical positive thinking to cover up their negativity. The person say, "Wait, nothing is wrong. I'm happy. I'm happy. Nothing is wrong," even though they be just bad news, devastated. This kind of insidious positive thinking is like trying to get rid of your house deadly mold by simple painting over it. This does not solve the problem. It only coats it with a temporary distraction, which will probably later lead to disastrous consequences. CBT is flexible, more flexible. This means that if a person feels nervous about delivering a speech before a crowd, that can think flexibly about the situation. If the individual said to himself, I'm not going to mess up, so I shouldn't be worried, it won't help. As it suddenly is possible to mess up, the person is told to thinking of other perspectives. They can think, example, I can still do well and succeed even if I make a mistake. Okay? 3. CBT ignores emotions. That's common myth. Nothing could be further from the truth than saying CBT disregards emotions. The truth is that emotions are very, very important part of the process of therapy. They are only handled with a different approach from other therapy types. In CBT, they are concerned in hand with the person's intellect instead of coping with the thoughts on their own. This is because it is cognition which affects the thought, behaviors, and emotions of person. Therefore, you must first understand the reasoning underlying them if you want to deal with difficult and problematic feelings. 4. CBT ignores the past in childhood. That's myth. The truth is the CBT usually focuses on the issue that current affect a person, the here and now. But if possible, a psychiatrist will look back on the past of their patient and how that history can affect their memory and cause problems with their person's life, their present life. If a person has a disorder of social anxiety, the therapist can discuss situations in the past that may have triggered fear of social interaction. A person may be able to look back on their past and see how it has adversely affected their cognition. But only a trained therapist can do this reliably. The reality is that we cannot look completely objectively at our own past, particularly where trauma is involved. A psychiatrist, however, specializes in understanding their difficult past and memories with the ability to learn how to restructure thought in a balanced and healthy manner. Number 5, CBT only treats symptoms, not the problem. CBT only treats the symptoms, not the problem. That's not true. Cognitive behavior therapy treats an individual as a whole without reducing their set list of symptoms. Right? Yeah? This is because it must first alter a person's attitude before it can even treat symptoms. As a person's comprehensions increase, they will find themselves learning about the world around them, people, and themselves in a more balanced way. In turn, this creates a change in the mind, emotions, and behavior of an individual. The result is a therapy that focuses on the external fixes inside, rather than just cover up external symptoms while ignoring the internal problem. Okay. Number 6, common myth. There is limited scientific evidence supporting CBT. The reality is that cognitive behavior therapy has a high level of scientific evidence to support its effectiveness, particularly when compared with other types of psychological therapy. A meta-analysis conducted by Boston University reviewed more than 100 reports on the use of CBT for different disorders, addictions, cause of stress, and other potential situations. This meta-analysis believed that CBT was more effective in almost all cause than other forms of therapy employed. Not only that, but people with anxiety disorders, general stress, anger control problems, bulimia, and somatoform disorders were found to be particularly effective. Number 7, CBT requires the person to be motivated. It really, as they begin, most people struggle with these things and therefore are unmotivated. But given this lack of motivation, these people are finding success time and time again and find themselves enjoying incredible benefits. Even for unmotivated person, CBT works if they have a schedule with goal, preparation techniques, and the person to be accountable. For most people, this person is the therapist, but you can also remain accountable to a friend or a family member. The person you are caring for should understand the therapist theory, so try to get them to read book or giving them videos that will help them understand the procedure. if the person understands what you need to do, they can make sure that you are doing it well and can provide advice when it is necessary. One of common myths is long, short-term psychotherapy. People tend to think CBT is either long-term or short-term. The reality is halfway everywhere. CBT has a set number of sessions, unlike some forms of therapy which requires a person to go multiple times a week for unforeseeable amount of time. The therapist should find by the end of these sessions that they have restructured their cognition and ready to go out into the world on their own. On the other hand, neither is this necessary a short-term therapy, while they are typically a set number of 5 to 20 weekly sessions. The number of sessions can continue for as long as the individual needs them. You need not worry about getting only 5 sessions if your case needs 20. Number 9, CBT is really easy. It's true that cognitive behavior therapy is a simple and straightforward therapy that anybody, adult or child, can perform. It is important to remember, however, that no therapy is really easy. All forms of therapy will have their own difficulties, as it is not easy to overcome our inner pain, trauma, or habits. It will take patience and hard work to restructure your mind into a more cohesive and safer mindset. You will need to make sure you are using your ground techniques on a daily basis and keep yourself honest. Using CBT, you will find at the end of your time that the effort and work you put into restructuring your cognition was worth it. Common mistakes like that, not understanding the importance of repetition, using positive thinking in place of CBT, not making use of relaxation techniques, believing emotions are irritation, using CBT to justify a lack of responsibility, demanding rationality, not making a lifestyle change. People who have tried cognitive therapy, either with a process misunderstanding or without a specialized CBT therapist, may be frustrated or say the process is not working, that it is failure. However, studies repeatedly show us that the process is effective. If a therapist who is specialized in CBT employs the process on their patient, and why are the perspective different? Simply, if a person uses a psychiatrist who does not understand the process, does it alone without proper knowledge, they are going to make mistakes, and these mistakes are not encouraging change. One of the biggest errors leading to failure is a failure to understand the importance of a repetition. You can tell a person how they should and shouldn't think, but that doesn't guarantee that they will automatically change. Rather, they have to use techniques and tools to facilitate the transition in their daily lives. We have to use these methods every day and throughout the day. Unlike other forms of therapy, you are not just talking to a therapist and then going for a week along your way. You have to make an effort to change your cognition directly, and you do that by repeatedly using the tools and knowledge that you have been given, just as you can master archery by shooting off a dozen arrows. You can master single time restructuring in your cognition by using a couple of techniques. Using positive thinking in place of a CBT. We mentioned earlier that some people may believe that all the CBT entails in positive thinking, which it couldn't be farther from the truth. A person restructures his or her mentality with cognitive behavior therapy to function in a more balanced way. On the other hand, positive thinking is either insincere too often or refuse to see the negativity which is plain as day. The reality is that while we don't want to think in a negative way, it's important to be able to see challenges and the bad in our life to resolve and solve them. Ignoring negativity is like failing to see a storm heading straight in your direction. Failing to say something positively, the reverse would be person lying in the fetal position, mourning we must die, and refusing to do anything similar to the storm tank. You should be able to recognize the tornado coming your way with the balanced cognition, but also do something about it and move for safety into the storm shelter. So remember, CBT is not a matter of positive or negative thinking, but of balanced cognition. Okay? 3. Not making use of relaxation techniques. Therapists will frequently receive reports from their patients explaining that they feel stressed and anxious. When asked if they use the relaxation techniques they have been given, such as deep breathing, mindfulness, the person may respond, "Not really," or "a few times." The problem with this is that you can expect to benefit from something you don't frequently and actively use. Think about it. While we all love it, if we could start losing weight simply by eating healthy for one day, we got to practice regularly eating healthily to see results. The same applies with the relaxation techniques. If you want to benefit from these techniques, the reduction of stress and reduction of anxiety, then you will need to put frequently into the effort. So keep putting these techniques into practice at least once or twice a day, and over the next few weeks, you will find your stress, anxiety greatly decreasing. Once your stress reduces, just don't slack off. Keep practicing this every day, regardless, as they will keep your stress low. Believing emotions are irrational because of thoughts and emotion are based on our intellect. Some people begin to believe that they have to be completely irrational in their experience, that they wouldn't feel anything if they were balanced and rational at all. But reality is that sentiments can be irrational, or natural. After all, when someone makes an innocent mistake, you can feel irrational angry, or you can be rationally angry at the injustice and senseless violence that has taken place. Human beings are emotional beings, and you just can't write off all our emotions. We are an important part of ourselves that helps us to think, interact with the group, and become more concerned about the world around us. You're not supposed to be a robot without any feeling. You are made more than someone who makes up scripts and zeros. So don't try to get rid of these feelings yourself, you can see a more balanced cognition while still enjoying those valuable sensations. Number 5, using CBT to justify a lack of responsibility. That's a common mistake. A person is encouraged to accept who they are by cognition behavior therapy and to value all facts of themselves. This is intended to be used as a basis for growing and improving upon yourself. But some people take this as a justification for simply feeling good about themselves and not caring about progress. They that tolerate their flaws to such a degree that they don't care if they hurt others with those shortcomings. You often see that in people who pride themselves on speaking bluntly or honestly. Yeah, speaking honestly is a good thing, but often when people brag about it, they only use honesty as a justification for doing cruel and unnecessary things. Demanding rationality. You will want to start restructuring your cognition as you learn about the importance of rational and balanced cognition. And benefits is offered. Excuse me. Some people will take this the extreme of casting themselves for failing to match an immense standard, believing they should always be completely rational. The truth is this is not rational itself, as it is unrealistic expectation which cannot be achieved. Also, we are human beings making mistakes, so we cannot always be 100% moral. That is not what CBT is or talks about. The aim of improving our mindset is essentially to enhance our mental health and depression by having a more realistic view of the world and of ourselves. This is also an irrational thought, as it is black or white thinking that says, if something isn't good, it must be bad. You're not meant to see everything is black and white with this therapy, but rather see that there are a variety of shades between these two colors. Nothing making our lifestyle change. It's a common mistake. Through cognitive behavioral therapy, you are not just trying to avoid acknowledging unreasonable or pessimistic thoughts. Alternatively, you are consciously teaching your brain to respond to stimuli in a different way. If you don't put in the practice hours, you can train your brain. Just reading book, it's a reading book is a first move, but if you don't bring it to the daily practice, it won't help you. You can just run a marathon by reading a book on how to run better. Instead, you have to work out every day and train at the same time for months. The same refers to cognitive behavior therapy. You will have the regular daily practice for a few months if you are really hoping to make a change a success. If you want to restructure your intellect, reading a few words on a page, you can't do it. You must actively use every day, all day, the techniques and tools you have learned. It may take time, but you will soon find yourself changing if you make a lifestyle change by thoroughly incorporating CBT into your daily routine. Okay, next, we're gonna learn the DBT. You know the DBT, dialectical behavior therapy. So, how to use dialectical behavior therapy to manage and overcome anxiety, anger, depression, worry, and stress. That we're gonna do this. Just the introduction, the DBT, about DBT. Anger, anger is emotion that fascinating and it is significant. It can bring passion and energy to our lives, supplying us with an electrifying joy that helps protect us, fight injustice and oppression, right? Or defend our rights and challenges those who mistreat us. Anger can also be incredibly frustrating given its utility, appearing like an unexpected visitor who ruins the gathering. It can be a major roadblock, putting our families, relationship, and career in the way. If we love or hate vengeance, hang on to it or be scared of it, raises almost always captivating. Anger can be emotion that is highly empowering and energizing, giving you the strength you need to smash down wall, succeed, and work hard to attain a goal. The goal that is not to get rid of anger, but to appreciate it and to learn how to manage it and use it to accomplish what is important to you. Over the last 20 years, we have found that when combined with scientifically validated therapies, dialectical approaches derived from Buddhist philosophies show an improvement of therapeutic result. Originally, this change was evident in patients suffering from personality disorder. But now we can argue convincingly that these standard therapies increase the care of people with many different disorders, most particularly those with a major component of anxiety. How can one rebound from panic, fear, phobias, PTSD, and propensity to worry too much that one's capacity to enjoy life is impeded? The process involves developing a sense of where you are in the process of recovery, realizing that you want more from your life and refuse to be stopped from seeking rehabilitation. This self-efficacy is what psychologists call the desire to see your way through the obstacles before you. Mindfulness is coping strategy that encourages positive performance at the present moment and fosters a sense of trust beyond the ordinary. Practice is the secret to improving mindfulness. Starting with the most basic skills, one can advance easily to adapt mindfulness-based skills to the most complex and challenging situations and environment. The benefit for actively implementing the skills are changes in one's outlook about what is important in life. If you master those qualities, you will learn to do the things you think you can't do. Okay. What are the distress tolerance scale. What are the distress tolerance scale? At any point in our lives, we all needed to cope with distress and pain. It can be painful, like a bee sting or a broken arm, or if it can be mental, like a sorrow or anger. The pain is often unavoidable and, in both cases, unpredictable. You can't really predict when a bee will sting you or when something will make you feel sad. The best thing you can do sometimes is to use the coping skills you have and hope they work. Sometimes such circumstances feel like they will never stop, and the people who encounter them don't know how to deal with the intensity of their pain. People who deal with intense feelings frequently treat their pain in very risky, sometimes harmful way, because they don't know what else to do. This is easy to grasp. It's hard to be rational when a person is in emotional pain and think about good solution. All of coping mechanism people with intense feeling use tend to just make their challenges worse. Now that you have recognized some of your own self-destructive and dysfunctional behaviors as well as their cause, the first approach to pain tolerance you need to know is REST, rest. REST, rest is an acronym which reminds you: relax, evaluate, set an intention, take action. Changing some behavior pattern is hard. You need to learn what you want to do when you want to change them and what else you want to do instead. Although as important, you will need to remember first and foremost why you want to do something differently. If you're overwhelmed by intense feelings, your first instinct is always to behave impulsively and participate in some form of self-destructive or dangerous repeated act. This is because you may not even remember that you intended to do something differently. in those times of heightened stress unless you've prepared. So, how do you plan on making healthier choice when you feel overwhelmed? The first move to fix any problem or self-destructive behavior and not to act impulsively is to follow the strategy of rest. Relax, evaluate, set an intention, and take action. Relax. Stop what you are doing. Stop. Freeze. Breathe in. Pause. Let the situation off for a few seconds and get a new viewpoint. Don't just do the typical thing you do. Don't rely on stimuli. Do your best to note you have the chance to behave differently. Build a space between your ability to behave impulsively and your actual reaction. Maybe say out loud, wait, relax, or rest. Just to warn you not to react too quickly and automatically, and take a couple of deep breaths to help you calm down before taking some specific alternative action. Evaluate. Next, remind yourself what is going on in that situation. What are the facts exactly? What are the facts exactly? Just to do a brief analysis. You don't have to work it all out. You don't have to do a thorough analysis of why you feel the way you are doing. You don't even have a fix the problem if that is too hard. Just do your best to get an overall feel of what's going on. Observe, for example, what happens to you physically, emotionally, and mentally. Observe what other people are doing around you too. Maybe just ask a few simple questions like this. How am I feeling? What's going on? Is anybody at risk? Next, set an intention. In this scenario, aim is an objective, goal, or strategy about what you will be doing. Decide what action you wanted to take. Tell yourself, what do I need? Then maybe choose one of coping skills or self-relieving skills you will learn. You have a bigger problem to solve, the later next will provide this sophisticated problem solving or communication skills you can choose from. Whatever you choose to, it doesn't have to be definitive or only solution to the problem right now, but it will ideally be a good thing to help you deal with. Let's think. Take action. Take action. Put your plan into motion. Put your plan into motion. Go forward attentively, which means moving gradually and with the knowledge of what you are doing. Whatever your last move goal was, now do it as quietly and efficiently as you can. Now, taking action may not be the perfect solution to the problem at hand, but if you follow the steps, the proactive response would certainly be safer and more successful than the self-destructive actions you would have done if you had just responded impulsively. Okay. If rest isn't working for the first time, go ahead and use it again. You may have missed an important aspect, or maybe something has changed quickly. So now they are familiar with the rest strategy. The next step to changing your self-destructive and dysfunctional habit is to recognize and predict when rest is likely to be required. Normally, you'll realize that when you are experiencing as intense negative emotion, there is a chance to do something better. Practically, an emotion that makes you want to stop something or get angry with someone. When you do, it is usually an indicator that something is going to happen that will force you to make a choice. Either you are going to act impulsively and do what you always do, or you are going to use one of the copying skills and do something differently. Okay. Next, we're gonna learn the radial acceptance and distract yourself from self-destructive behavior like cutting, drinking, lacking in self-mutilation, and distract yourself by paying attention to someone else. We're gonna learn that. And relax and smooth yourself, and anxiety and depression and anxiety disorder. We're gonna learn that. Anxiety and anxiety disorders, and understanding anger from the inside out. Okay, see you next Bye bye.